Hi, I'm Louise. I'm a physiotherapist at Movement Sports Clinic. We're going to talk today about our blog post of physiotherapy running assessments. And what this is mainly for is people as runners who are having issues with injury, probably one that may be persistent or recurrent, as well as those that are just having a new recent injury and they're trying to understand it. As well, we like to do this assessment with people for injury prevention, because the more you can learn about your body, and we'll talk about some of those factors that can influence your injury risk, that can minimize injury down the road. And the other component is performance, because if you're not injured and able to push yourself harder in your training and train regularly, your performances will be better as a result. When you come to the clinic for a running evaluation, you can expect the following components. Subjective history, which means we ask you a lot of questions about what's gone on in your past, as well as a physical evaluation, and then we also look at the treadmill running video analysis. Finally, we come up with some recommendations. To start with, we'll ask a number of questions to learn what's unique about you, your body, how it responds to stress, and what makes you vulnerable to injury. We'll ask you questions like injury medical history, your running background, and your goals. In the physical assessment part, we look at a movement screen where you're asked to do some basic movement patterns that help us assess your mobility, balance, strength, and stability. We also examine your joint range of motion, muscle activation patterns, and tissue extensibility. And your muscle strength is also tested. We will also palpate for some tight muscle bands and tender points, which may help us localize sensitized areas in the body. With the treadmill video section, we watch a runner from different angles in real time and slow motion, and all this information will complement what we find in the physical examination. We'll look at how much bounding there is in the stride, numbers of footfalls per minute, arm swing pattern, leg crossover pattern, foot strike, body lean, trunk rotation, things like your hip drop and your breathing pattern. All these things are factors that we can consider and match up with what we find clinically and from your history to what we see when you're running on the treadmill. We'll review the video with you and help point out some relevant findings that may help improve your body awareness and your training. To come up with some recommendations based on your goal for injury management, injury prevention, or improved efficiency and performance. Recommendations are usually one or more of the following: a home program, which will help deal with mobility, strength, or stability issues, possibly running cadence or style changes, running drills to help improve body awareness and efficiency, and maybe some training modifications with respect to frequency, duration, and intensity of your training schedule. We may also recommend treatment in the form of manual therapy or dry needling to help resolve injuries. We hope you enjoyed this inside look at a physiotherapy running assessment, and we look forward to seeing you in the clinic soon.